Okay, I'm going to start with the superior vena cava, which splits into the brachiocephalic, right and left. It splits into the subclavian, right subclavian vein. This one goes into the right jugular vein, which splits into the external jugular vein and internal jugular vein. The artery starts here, the aorta starts here out of the heart, which it goes into the aorta arch. The aorta arch branches out into two, which is the left subclavian artery, and then into the brachiocephalic artery, which this one branches out into three, into the left common carotid, right common carotid, and the right subclavian artery. This is a phrenic nerve which runs from each side of the neck down into the heart, along the lungs, into the diaphragm. We have on the right side of underneath the lungs, on the right side we have the azygos vein, which branch out into the posterior intercostal veins. On the left side of the lung organs, we have the aorta, which branches out into the posterior intercostal aorta arteries. And then we go down to the hepatic portal, which is connected from the stomach to the small intestines. This is the hepatic portal, which attaches into the superior mesenteric vein, and somewhere along here it goes into the gastrosplenic veins. And then we look for the adrenal gland. The adrenal gland, there's three branches that come out of the adrenal gland. One is the celiac trunk artery. Second one is the superior mesenteric artery, and the third one is the inferior mesenteric artery. And then we go down into the renal. There's two renal artery, renal vein. And we have the ureter tube that drains the urine into the bladder. Back here we have the abdominal vein and abdominal aorta, which are in the abdominal region. And this aorta goes all the way down and splits down into the hip, into the right and left common iliac veins and arteries, which go into the lower limbs. That's it. And then the organs, this is the bladder, large intestine, small intestines, goes into the small intestines attached to the duodenum, into the stomach. Then we have the greater omentum, which is a fatty tissue that overlies all these small intestines. We have the liver. Liver here underneath the dark is the gallbladder. Above it, which separates the abdominal cavity from the thoracic cavity, we have the diaphragm. Up here we have the lungs on each side. In the middle we have the heart. There we remove the thymus that was overlying on top of the heart. And that's about it.
The layers of the stomach?
The layers of the stomach, this is the abdominal portion. If we close it up, we have three layers in the abdominal muscles. The top layer is the external abdominal oblique. We have the internal abdominal oblique, and we have the transverse. abdominal.
I don't know if it's oblique.